What are fillings and crowns? Tooth filling is the clinical treatment that treats a cavity. Your dentist will remove the decayed portion of the tooth and then fill the area on the tooth where the decayed material once lived. Fillings are also used to repair cracked or broken teeth and teeth that have been worn down from misuse, such as from nail biting or tooth grinding. Fillings and crowns can be made of several different materials. The most common type of filling is dental amalgam, made from a mixture of different metals. Dental amalgam fillings are hard-wearing, so are often used on your back teeth. Your dentist will offer you the type of filling most appropriate for your clinical needs. For example, if you need a filling for one of your front teeth, your dentist may suggest a tooth-colored filling, but the use of tooth-colored fillings on back teeth is considered purely cosmetic. Fillings can be made of several materials. You've may already heard about amalgam. It's silver-colored material that consists of mixture of metals, including mercury, silver, tin and copper. There's also a composite. It's tooth-colored and made of resin and glass mixture. Glass ionomer is also tooth-colored material. It's made of powdered glass, which forms a chemical bond with your tooth and may release fluoride that helps to prevent further decay. There are a number of articles on the internet about the alleged toxic properties of amalgam. Although amalgam fillings can release low levels of mercury vapor, particularly when they are put in or removed, there is no evidence that exposure to mercury from amalgam fillings has any harmful effects on health. A crown is a type of cap that completely covers a real tooth. Crowns can be made of different materials for different purposes. Ceramic dental crowns. Ceramic, porcelain-based dental crowns are most often used to restore front teeth. Due to their natural color and texture, ceramic crowns are able to blend effortlessly with your remaining natural teeth and can be given a hint of color to match your natural teeth. Porcelain crowns are not well suited for molars and premolars, as ceramic can become brittle when exposed to heavy biting forces. Porcelain fused to metal dental crowns. Porcelain fused to metal crowns provide patients with the best of both worlds. The porcelain part of the crown provides the patient with a natural-looking tooth, and the metal structure is ultra-durable. To undergo a porcelain fused to metal restoration, the dentist must remove a moderate amount of tooth structure. Gold alloys dental crowns. Dental crowns constructed of gold alloys contain a combination of gold, copper, and various other metals. Gold alloys provides a number of perks over other dental crown types. This type of crown is strong and will not fracture. It will also not wear away the underlying tooth. Gold alloys are also biocompatible with gum tissue. Base metal alloys dental crowns. Base metal alloys dental crowns are resistant to corrosion and incredibly strong. They also contain non-noble metals that are gentle against neighboring teeth. Only a minimum amount of tooth structure must be removed before a dentist can apply this type of crown. Your dentist will offer you the type of crown they consider clinically necessary. In the next video, I'll tell you about the type of clinical treatment when your teeth are missing. Thank you for watching.